planet and the need for global Earth innovation. We are a critical juncture in human history. Climate change, pollution, and environmental degradation are threatening the very survival of our planet. Rising temperatures, melting ice caps, and extreme weather events are just a few of devastating consequences of our action. But we are not here to dwell on the problems. We are here to explore the solutions. We are here to harness the power of innovation to create a better future for all. Global Earth innovation is about harnessing the power of technology, science, and human ingenuity to create a more sustainable, equitable, and just world. It's about developing new technologies that can help us reduce our carbon footprint, increase energy efficiency, and promote sustainable development. It's about creating new business models that prioritize sustainability and social responsibility. It's about developing new policies and regulations that support innovation and entrepreneurship. But most importantly, global Earth innovation is about people. It's about empower individuals, communities, and organizations to take action, to make a difference, and to create positive change. So what can we do? We start by making conscious choices in our daily life. We can choose to use public transport or to carpool or to drive electric vehicles. We can choose to use renewable energy to reduce our water consumption and to reduce our waste. We can support companies and organizations that prioritize sustainability and social responsibility. We can invest clean technologies and business that promote sustainable development. We can demand that our leaders take action to address climate change, to promote sustainable development. We can hold them accountable for their action and for their policies. And we can innovate, we can develop new technologies, new business models, and new policies that support sustainability and social responsibility. So let us work together to create a better future for all. Let us harness the power of innovation to create a more sustainable, equitable, and just world. Let us make a difference starting today. That is all my opening speech. I appreciate for your attention. Have a nice time for all. Thank you.
Thank you so much, Prof, for your wonderful and inspirational remarks. Okay, now we move on to the main season, delivered of the material by Prof Matsugu Nemoto. Prof Natsugu, konnichiwa. For your wonderful and inspirational remarks. Okay, now we move on. Okay, Prof, are you ready? Delivered of the material by Prof Matsugu Nemoto. Prof Natsugu, okay, and moderated by Ibu Nadhiroh Hardiana, a lecturer in the public financial accounting. For Prof Nemoto and moderated by, please proceed. Prof Natsugu,
Okay,
okay,
thank
and
you very much
moderated by
to our
Ibu
Master of
Nadhiroh
Ceremony,
Hardiana,
Miss
a
Vivi
lecturer
Oktari.
in the public
Can you
financial
hear my voice
accounting.
clearly?
For Prof Nemoto and moderated by, please proceed.
Okay, thank you and good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. And warm greetings to all participants joining to our today's season. I'm Nadhiroh Hardiana, and it is a great honor for me to serve you as a moderator today for this special season of the Global Health Innovation Series under the theme Model and Cases for Developing Countries, Remote Healthcare by Korea and Japan. Okay, this international e-lecturing event is proudly hosted by Financial Accounting Study Program at Universitas Terbuka and in collaboration with the Forum Dosen Akuntansi Publik (FDAP). Today's topic is especially timely and relevant, I guess, as many developing countries are exploring effective models of remote healthcare in response in increasing health demands and limited resources. We are privileged to gain insight from countries like Korea and Japan, which is leader in the remote healthcare innovation, which may inspire contextually adaptable solution in developing nations. Okay, it is my distinct pleasure to introduce our keynote speaker today, Professor Masatsugu Nemoto from Chungbuk National University, Korea. Before we hear his presentation, allow me to briefly introduce Professor Nemoto to all of you. Professor Masatsugu Nemoto, a distinguished scholar in public administration and international development, originally from Japan and currently based in South Korea. Professor Nemoto earned his PhD in public administration from Chungbuk National University in 2009, following his master and bachelor degrees in social science from Ibaraki University, Japan. His research focused on improving audiovisual development assistance effectiveness through approaches such as intellectual property integration and social economy model. His projects have been supported by the National Research Foundation of Korea and other national agencies. From 2016 to until now, Dr. Nemoto, Professor Nemoto has published widely on topics including community well-being, urban regeneration, social enterprise, and the use of AI in development planning, which case studies from across Korea, Japan, Indonesia, and Bangladesh. And currently, Professor Nemoto serves as a research professor at International Development Institute of Chungbuk National University, and also the director of the social cooperative called Q Friends, reflecting his strong involvement in both academic and community-based innovation. His contributions have been recognized through various awards, including the Excellence Award for Welfare Policy Innovation in South Korea in 2021, and the Gold Award for Innovation from University Technologi Mara in Malaysia in 2019. Okay, now we are truly honored to have Professor Nemoto with us today to share his knowledge, experience, and relevant case studies. Okay, Professor, before we begin, I would make a few reminder for our participants to keep your microphone muted during the presentation, and you are welcome to submit question and at any time via chat box. But when you want to ask directly, you can raise your hand after the speaker presentation. All right, without further ado, let us now welcome Professor Nemoto to begin his session. Professor Nemoto, the screen is yours. You can raise your hand after the speaker presentation. All right, without further ado, let us now welcome Professor Nemoto to begin his session. Professor Nemoto, the screen is yours. directly, you can raise your hand after the speaker presentation. All right, without further ado, let us welcome Professor Nemoto to begin his session.
Hello,
Professor
can you see
Nemoto,
the
the stage is yours.
PPT?
Yes, it is.
Thank you for your introduction, and thank you very much to invite me today. I am Masatsugu Nemoto, research professor in International Development Institute, Chungbuk
Yes,
National
it is.
University, Korea. Today, I would like to introduce models and cases of telemedicine for developing countries from South Korea and Japan. The models were extracted from previous research in both countries, meaning why the cases were extracted by searching for actual cases from South Korea and Japan. Introduction. Korea recognizes that excellent medical services utilizing ICT are a paradigm that can provide better health-related services and is focusing particularly on improving the quality of medical services through data sharing from remote areas. This is based on the recognition that there is an urgent need to improve the quality of services in ODA target countries with poor medical environments. Japan also aims to contribute to reducing the medical gap and improving the quality of medical care in developing countries by disseminating medical information technology using ICT. Telemedicine is closely related to the following four elements. The purpose of telemedicine is to provide clinical support. Telemedicine connects users who are not in the same physical location and aims to overcome geographical barriers. It involves the use of various types of information and communication technologies. The goal of telemedicine is to improve healthcare outcomes. It involves models presented in previous studies of information and communication technology. The table shows a list of papers searched in Korea using keywords such as telemedicine and ODA. Models presented in previous studies. Model proposed in developed table shows a list of an EU health service model for ODA recipient countries. Individualized optimization models. These include models in which patients with chronic diseases measure their blood glucose and blood pressure at home and send the data to a health center for management, or model in which patients visit a clinical periodically for management. Glucose and blood pressure at home and send the data to a inter-hospital telemedicine IHTM system. This is a model that enables smooth remote medical treatment without the inconvenience of patients traveling. By allowing local doctors in ODA recipient countries to consult with specialists online and receive feedback when a more accurate diagnosis is required for a patient. This minimizes remote medical treatment with overseas and regional national hospitals and markets, and makes it possible to obtain prescriptions quickly and conveniently. Model proposed in an examination and the development of evaluation criteria to enhance Korea's ODA performance. Vietnam's medical challenges. Vietnam has only 63 general hospitals for a population of over 90 million. and the hospital bed occupancy rate is 250%. WHO recommendation is 85%, which is an extremely serious situation. South Korea's ODA performance since establishing diplomatic relations with Vietnam in 1992, South Korea has been interested in ODA projects and has selected Vietnam as a priority cooperation country since 2011. South Korea has been in the past the e-health capacity building project in Vietnam from 2015 to 2018 project 13 million US dollars has been moving forward with the computerization of the Korean-style medical insurance system and the construction of a hospital medical information management computer system. But a fragmented Korean-style computerization of the Korean-style information system and the construction of a hospital medical information has emerged as a problem. Therefore, in order to avoid repeating the mistakes of Korea, it is emphasized that it is necessary to design it as a single public system from the beginning. As a program. Therefore, in order to avoid model proposed in analyzing the demand ICT International Development Corporation in Africa to design examples of telemedicine from the beginning. In Rwanda, mobile telemedicine, disease prevention and management, emergency reporting, medical education, data collection is being implemented. In South Africa, One Connect, a mobile communication platform for pregnant women. And in Rwanda, British startup Babylab helps provide low-cost medical consulting. In South Africa, One Connect, a mobile communication platform utilizing cutting-edge technology. In South Africa, a robot pharmacist was introduced for HIV-positive patients, reducing waiting times. In Rwanda, drones were used to transport emergency medical supplies, significantly reducing transport times for HIV-positive patients, reducing waiting times. Korea's ICT ODA strategy. Drones were used to transport proposed project types include a project to strengthen ICT infrastructure for building a mobile healthcare environment.
Recording stopped.
And the project to develop an ICT-based smart quarantine system at border quarantine stations. Korea's unique
Recording
strength.
stopped.
Korea is ranked fourth in the world in the field of intellectual property rights, and it is considered important to introduce technology, appropriate technology, that is suited to the level of the recipient country. In addition, when direct local implementation is difficult, active use of the multi-buy approach in cooperation with international organizations is recommended. In addition, models proposed in toward enhanced medical cooperation between Korea and Latin America in the post-corona era. Electronic medical records (EMR) are the most fundamental key to digital hospital operations, and although EMRs are widespread in individual hospitals, compatibility for information exchange with other hospitals is a major issue. Brazil, Mexico, Peru, Chile, and others are aiming for a national EMR system, picture achieving and transmission system, X, and radiology information system, RIS, are also important for sharing medical images and have growth potential in Latin America. Transmission system, telemedicine, are used for tools to eliminate healthcare disparities in Latin American countries where medical facilities are concentrated in large cities. Chile is a pioneer in telemedicine, with 68% of hospitals offering telemedicine services in 2018. The telemedicine market in Latin America is expected to reach 34.8 billion US dollars by 2025. The telemedicine market in Latin America is expected. Korea's Latin America Medical Corporation strategy, billion US dollars by 2025. Proposal for the HEPI model, an acronym for Hospital Equipment Program and ICT, referring to the unit of entry into Latin American epidemic prevention and medical market. Country strategies: Brazil, HEPI, with the vast land area and population and numerous digital hospitals. The market for remote medical care and AI medical care is large. Mexico, HEPI, with the large population and high degree of integration with the US, it is advantageous. Investment in mobile apps, medical robots, 3D printing, remote medical care, and medicine and machine learning services are promising. Peru, HEI, with widespread use of EMRs and preparation for digitalization. It has experience building remote medical care and imaging systems with South Korea. Argentina, HI, hospital digitalization is underway, and the medical infrastructure is relatively solid. The vast land area requires a mobile remote medical system. Argentina, HI, hospital digitalization is underway. The table shows a list of papers searched for in Japan using the keywords telemedicine and developing countries. Kyushu University Hospital Telemedicine Development Center of Asia provides telemedicine education and technology training for IT engineers and physicians from medical institutions and academic networks in developing countries in Asia Pacific region. The aim of this training is to develop specialized staff who can support the technical aspects of telemedicine and academic training content. A wide range of training, including remote conference system setup, equipment operation, medical document sharing, troubleshooting. Participants will acquire practical skills through live demonstration and group discussions. Kagoshima University accepted trainees from developing countries such as the Philippines and Indonesia through the JICA Remote Island Medical Care course. This course utilizes Japan's experience in remote island medical care, mobile clinics, remote medical care, comprehensive community medical care, to develop human resources involved in remote island and rural area medical care. Integrates a telemedicine system with a centralized medicine logistics system. It is expected that this will enable patients in rural areas to receive the medicines they need in a stable manner. Centralized medicine logistics system. There are cases from Korea and Japan. This will enable cases from Korea rural areas to receive the medicines they need in a stable manner. SIS and the telemedicine digitalization project for improving the quality of medicine service to the underprivileged in Peru from 2021 to 2026, $7 million. COICA and the Peruvian government will first establish an electronic screening and evaluation system for the integrated health insurance, SIS, for all citizens and digitalize the screening and evaluation procedures for medical expenses claimed by medical institutions and the insurance benefit system. This will drastically improve medical administration so that medical institutions can quickly receive health insurance benefits claimed by the Integrated Health Insurance Agency. Local residents are using the integrated health insurance application. Peruvian integrated health insurance officials are providing education to local residents about signing up for integrated health insurance. Telehealth to improve access of healthcare services for disadvantaged group in Vietnam. Through this project, it is necessary to expand into a digital healthcare business by building a platform that can manage residents' blood sugar, blood pressure, diet, exercise, and medication on an advanced medicine platform, and providing necessary education materials, card news, newsletters, education videos to local residents through smartphone or mobile phones. In addition, residents of geographically vulnerable areas have difficulty or unable to access professional media services. To address this, they plan to activate telemedicine, which is being promoted in the host country through a platform. AI-based software for diagnosing sexually transmitted infections. This software has been piloted in several countries, including the Philippines, and has recorded a diagnostic accuracy of over 90%. This technology is expected to play an important role in response by enabling rapid diagnosis and treatment. Cases from Japan. Smartphone-based obstetric checkup platform. The maternal mortality rate in the Democratic Republic of the Congo, the developing country, is about 10 times that of Japan at 846 per 100,000 births, according to 2017 JICA survey. The current situation is far from the SDGs target of less than 70. The founder, who was formerly stationed in the Democratic Republic of the Congo as a JICA employee, wanted to solve this problem through the power of business. So he founded Soy Corporation in 2019 in order to enable any medical facility to provide high quality of obstetric checkups. The company has developed and provides SPAC, digital obstetric checkup package that includes the smartphone app, medical equipment, diagnostic devices, and power sources. The pregnancy checkup using smartphone echo. perinatal telemedicine platform, the ICTG fetal monitoring device, and the Melody Eye perinatal telemedicine platform that utilizes it allow for remote management of the health of mothers and children, even if there are no medical facilities nearby, ensuring safe and secure childbirth. Regular screening not only makes it possible to predict and avoid high-risk emergency childbirth, but also contributes to reducing overall and the risk of litigation in the field due to the decline in obstetric facilities and obstetricians. In Thailand, Melody Eye has been introduced throughout Chiang Mai, and the service is being actively expanded, especially in rural areas where there are few obstetricians. AI-based health monitoring for pregnant women. Pregnant women who wish to receive the service are provided with a smartwatch, which measures their vital signs and transmits them to Rescue AI in the cloud. Rescue AI analyzes vital data, detects and visualizes abnormal values and the risk of disease, and notifies with alerts. Medical institutions can check the health status of pregnant women at any time on the AI platform, and if they detect any dangerous signs, they can provide prompt medical intervention. Ophthalmology remote diagnosis system, a mobile device that can take images of the eye, enter patient information and medical history into the dedicated application. Set the MSI on your smartphone, take a photo of the eye, and send the data. Based on that information, ophthalmologists input advice into the system and treat patients accordingly. A rural area of Bangladesh, access to eye examination is limited, so people line up in a large number to get an eye exam using this device. Drone-based malaria countermeasures. Fixed-wing drone photographs the area to detect puddles, and AI is used to identify puddles that pose a high risk of mosquito larval breeding. Pesticides are sprayed only in high-risk puddles. This will suppress the breeding of malaria-carrying mosquitoes, lowering the risk of infection for people living in the area. It is expected that the amount of pesticide sprayed will be reduced by approximately 70% compared to conventional methods, and labor costs for spraying will be roughly halved. Future outlook. I'm going to show short videos about the recent changes in digital medicine in Korea and Japan. If the studio staff has automatic subtitle translation function, please use it.
All right, Professor Nemoto, we will try to share the video. Please wait a second.
It's difficult. I will do by myself.
If the sound is audible?
No, Kak Nadhiroh. Nothing so.
I will do. I can do it. I can do that. I try.
2025년 1월 24일 우리나라가 세계 최초로 제정한 디지털 의료제품법이 본격적으로 시행. 2025년 1월 24일 우리나라가 세계 최초로 제정한 디지털 의료제품법이 본격적으로 시행됐습니다. 디지털 기술의 발전에 발맞춰 의료기기 및 의료제품에 대한 규제와 관리 체계를 혁신하는 법안인데요. 이번 영상에서는 디지털 의료제품법의 핵심 내용을 살펴보고 의료업계와 소비자들에게 어떤 영향을 미칠지 분석해 보겠습니다. 먼저 디지털 의료제품법이란 무엇일까요? 이 법은 디지털 의료기기, 디지털 융합의약품, 디지털 의료 건강 지원기기를 포괄하는 개념입니다. 기존의 하드웨어 중심 의료기기 규제와는 다르게 소프트웨어 특성을 고려하여 제품 전주기 관리 및 맞춤형 규제를 도입했습니다. 특히 이번 법안에서는 디지털 의료제품법의 위해성 등급 차별화, 보안 지침 준수 의무, AI 기술 적용 시 사용자 고지 의무 등의 핵심 규정이 포함됐습니다. 디지털 의료기기와 관련해서도 중요한 변화가 있습니다. 첫째, 디지털 의료기기의 허가 품질 관리 체계 강화입니다. 기존의 의료기기 규제 방식과는 달리 소프트웨어 검증, 전자적 침해 행위 보호, 사용 적합성 등 새로운 심사 항목이 추가됐습니다. 또한 AI가 내장된 의료기기는 기존 허가와 별도로 추가 허가를 받아야 합니다. 둘째, 디지털 의료기기의 임상시험 절차 간소화입니다. 환자와 직접 접촉하지 않고 데이터를 이용하는 임상시험의 경우 기존보다 간편한 승인 절차를 적용받게 됩니다. 하지만 개인정보보호법과 의료법 등 기존 법률을 준수해야 한다는 점도 유의해야 합니다. 셋째, 디지털 의료기기 광고 규제입니다. 소비자의 안전을 위해 디지털 의료기기 소프트웨어 광고는 의학학 전문 매체에서만 가능하며 일반 소비자 대상 광고는 금지됩니다. 그렇다면 이 법이 실제로 의료업계와 소비자에게 어떤 영향을 미칠까요? 먼저 의료기기 제조업체와 병원은 새로운 허가 및 품질관리 기준을 준수해야 하므로 기존 제품들의 재허가 필요성이 증가할 수 있습니다. 또한 AI 기술이 적용된 의료기기는 새로운 허가 절차를 거쳐하기 때문에 의료 AI 기업들에게도 중요한 변화가 될 것입니다. 소비자 입장에서는 의료 AI 기술을 활용한 맞춤형 진단 및 치료가 활성화될 가능성이 크지만 개인정보 보호 문제가 중요한 이슈로 떠오를 것으로 예상됩니다. 지금까지 세계 최초로 시행된 디지털 의료제품법의 핵심 내용을 살펴봤습니다. 이 법안은 의료기기 시장과 디지털 헬스케어 산업에 큰 변화를 가져올 것으로 예상되는데요. 시장과 기업에서는 법안에 발맞춰 적절한 대응을 준비하는 것이 중요하겠습니다. 관련하여 더 많은 정보는 영상 설명란에 링크를 클릭해 주시기 바랍니다. 뉴스레터 마치겠습니다. 감사합니다.
8時はウェイクアップ。手術が始まろうとしている。支援ロボットを使い胃を切除するのだ。しかし医師の横に手術を受ける患者がいない。なぜか。こちらは先月 北海道函館で開催された日本消化器外科学会総会での一コマ。患者は函館から遠く離れた東京新宿に。
これから胃のモデルを使って実証実験の方を始めさせていただきます。
遠隔手術の実験。熟練した外科医が胃の疑似モデルにメスを入れていく。使われているのはロボット、火の鳥。胃や食道など消化器外科をはじめ、婦人科、泌尿器科の保険適用手術でも使われている国産初の手術支援ロボットだ。コンパクトな設計で人の腕にはできない滑らかでより繊細な動きが可能。現在海外製の独壇場である手術支援ロボットの世界を打破するため、日本の産業用ロボットの技術を結集し開発された。
Does this sound familiar? You read about the cursor hype on Twitter. Went to give it a try.
政府も G7 群馬高崎デジタル技術大臣会合に伴い開催した展示会で、医療と通信技術が融合した最新のデジタル技術として世界にアピールしていた。北海道と東京を結んだ遠隔手術。長さおよそ740キロもの通信ネットワークを使って乱れは起きないのか。そしてタイムラグは。この日初めて遠隔手術を体験した外科医に伺うと、
こんなに遅れないもんとは正直違和感がないというか、東京でちょっと動いてるうちはびっくりですね。
0.025 秒という非常に低遅延なネットワークになっておりまして、光ファイバーの技術をベースとして商用ネットワークで実際今回実証を行っております。
この最先端の技術が必要な理由、それは
一番の大きな問題は、外科医の数がなかなか増えない。この20年間、外科医の数は変わってないんですよ。
1994年を1とすると、形成外科や精神科、内科などの医師は増加している。しかし、外科医は増加していない。さらに、袴田会長によると、外科医を含め医師は今、大都市圏の病院に勤務する傾向にあるという。
外科医療が関係するためには、そこでロボット医療が行われて、でそこに若い人たちが集って、そこで修練を受けて、定着して地域医療に貢献するというようなサイクルを作っていかないと、日本全体で質の高い外科医療を国民の皆さんに提供することができなくなってくるだろうと。
医療の格差が深刻になろうとしている今、遠隔手術を確立することは急務だ。医療現場の課題は他にも。
現在38度5分。はい。鼻水ですね。これも同じく今朝からでございますかね、症状は。
子供の急な発熱。往診の依頼を受けているのはファストドクター。新型コロナの患者や最近では熱中症患者への救急往診で知られている。現在、内科、小児科、整形外科など合わせておよそ3500人の医師が登録しているが、コロナ禍を経験して痛感したのが医療従事者の負担増だったという。病院や病床の数が減少している中、今後ますます高齢化は進み、ピークを迎える2040年には168万人が亡くなるという。どのように対処すればいいのか。
高齢化によって医療需要がピークを迎える2040年に向けても、主に在宅医療等が充実してこないと、結果として同じように病院の負担につながってしまうのではないかと。そういった部分の24時間体制、夜間休日部分をでサポートするっていうようなところであったりっていうところで、地域のかかりつけの先生と、我々がチームになって地域のかかりつけ機能を強化していくっていったようなところを目指しています。
ファストドクターは生活習慣病の予防の領域でもオンライン診療を開始している。
よろしくお願いします。
神と申します。よろしくお願いいたします。
愛知県在住の神谷さん、62歳。健康診断の結果は、血液中のコレステロール値が高め。経過観察の診察にファストドクターを選んだ。この日はお盆真っ只中。その上、台風が接近していた日曜日。東京にいる医師が診察した。
動脈硬化がそこまで進行してないよねっていうふうに評価することもできるんですよね。
そうなんです。
なので、だからその運動とか食事とかでできるだけちょっといろいろやれることはやってみて。
すごく便利です。このオンラインは6時から夜中までみたいな感じですので、仕事が終わった後にも診察を受けられるっていうのが何より便利ですし。
オンライン診療とか夜間往診とか、そういったような形で、その家にいて仕事ができる環境、家にいることによって、自分のその生活を犠牲にしないで働ける環境っていうのは、これからもっともっと必要になってくるんだろうなっていうふうに思います。
働き方を考えなければならないのは介護従事者も。こんなデータがある。介護を必要とする人は今後ますます増え、再来年にはおよそ243万人。2040年にはおよそ280万人と予想される一方、介護に携わる人は再来年に32万人。2040年には69万人が不足すると推計されている。開放的なエントランス。グランドピアノも。こちらがデジタル機器の導入が進む介護施設。レクリエーションの時間に訪ねると、人型ロボット、ペッパーとともに入所者が体操していた。
今ペッパー君との体操も拝見してたんですが、いかがですか？
いいですね。楽しいです。
この施設ではロボットを使って入所者の介助を行うのはもちろん、デジタル機器を利用して入所者一人一人の状況をつぶさに把握している。ベッドに設置してあるセンサー。これによって心拍数や呼吸数、睡眠をとっているのか、横になっているが目覚めているのか、はたまたベッドから離れているのかがわかるのだ。過去のデータも一覧できるので、健康管理にも役立つという。さらに、このセンサー、お腹につけておくと、膀胱に溜まっている尿の量がわかり、トイレへの介助やおむつ交換のタイミングを入所者それぞれに対応することができるようになった。
今までは動きの中で職員たちが動き回ってそれらの情報を集めて、じゃあこの人何時だねっていろいろ決めてたので、やはりそうすると人手も必要ですし、時間もかかるし、逆に言うとその利用者さんにとって適切なタイミングじゃないということもたくさんあります。
そして居室の天井には AI センサーとカメラが設置されている。例えば入所者がベッドから転落や転倒した場合、
大丈夫ですか？
大丈夫ですか？
即座に職員が持つスマホで警告される。深夜ともなれば、介護士はスイスイ移動。デジタル機器導入前、動き回っていた職員の移動距離が20キロにも及んでいたことから導入されたという。デジタル化はまだまだある。独自開発したのが介護記録のシステム。食事や水分、薬の服用情報などをタブレットに入力。これにより、すべての職員に情報が共有され、1日数時間も費やしていた申し送りが必要なくなった。
導入前と後っていう意味では 30% ぐらいの人員 の効果があるかなと。それは人が少なくてもいいということだけではなくて、職員のその業務負担とかですね、そういったところの軽減とか合わせて、それぐらいの数字だと。
デジタル化による職員の負担軽減は、人手不足の解消にもつながる。気になる賃金は？
他の法人さんと比べては十分しっかり生活できるだけしっかりもらえてるかなって感じてますね。
一方、入所費用は1ヶ月食事代込みで8万円から15万円だという。人生100年時代。避けて通りたい手術。そして介護。日本の将来を考えれば、医療・介護のデジタル化は避けて通れないのかもしれない。
Comparing the remote healthcare models and cases in Japan and South Korea that we have looked at above, the following characteristic emerge. That is, South Korea aims for a comprehensive system model, while Japan focuses on human resource development and logistics models. As examples, South Korea places importance on institutional reform, while Japan is active in device development. Both countries have in common the fact that they are trying to utilize AI. Implications. In terms of future prospects, advanced integrated systems and institutional improvements are expected in Korea due to the implementation of the Digital Medical Product Act. And in Japan, the spread of digital health and nursing technologies that have been put to practical use in areas of population decline and aging is expected. There is a need to ensure that emotional perspectives are not overlooked in telemedicine digitalization. It is important to formulate ODA projects that utilize each country's strengths through the submission of a project concept paper to the Indonesia ODA Coordinating Agency. Thank you.
All right. Thank you very much, Professor Nemoto, for your insightful and thoughtful, provoking presentation. And it is very interesting. We have learned also in the video, and we learned a great deal about remote healthcare model from Korea and Japan, and how they may serve as frameworks for developing countries. All right, now we'll open the floor for the Q&A session. Participants are welcome to type your question in the chat box or raise your virtual hand if you would like to speak directly. I will be happy to facilitate the discussion. And here we have one question from Mr. Chris. He said, Prof, I want to ask a question about fragmentation in digital system. In the implementation of digitalization projects, system fragmentation often emerges a significant challenge. How can the issue of digital system fragmentation, such as the experience in Vietnam e-health project, can be effectively addressed in future initiatives? That's the question, Prof. Okay, maybe in the first season for Q&A season, we will have 3 questions.
In Vietnam, the Vietnamese government is taking a lead in creating an integrated platform with South Korea operating with it.
Thank you so much, Prof. Nemoto, for your response. I hope it is clear for the participant who asked, Mr. Chris. And we have another question from Miss Vivi Oktari. Okay, the question is, does the reliance on advanced technologies in Korea and Japan's remote healthcare model unintentionally create accessibility barrier when applied in countries with low digital literacy? Okay, Professor, please share your thought about this question.
I think it is necessary to introduce appropriate technology in developing countries. Actually, my research institute is also researching the use of patents as appropriate technology.
Okay, thank you, Professor Pros, for your explanation. And I think there are no questions, but maybe can I ask question, Prof? If it's allowed. Okay. So I have watched a Japanese drama. It is called Dr. X, which is the surgeries were performed by AI or robots, while the doctor only supervised. And this raises an important question in my mind. So if there are some medical error or malpractice occur in this such a situation, who will be held legally responsible? I mean, can the AI be held accountable, or will the hospital or medical staff bear the legal consequences? Okay, that's my question, Prof. I just wondering if AI doing some malpractice.
Actually, I'm not an expert in this field, so if you send me an email with the question, I will send you a relevant reply.
Okay. Okay, later I will send email to you. Okay, I think the question in the Zoom, there are no question, and in the YouTube also no question. Okay, thank you, Prof, for the email. I will note and I will send you email later. All right. I think that is the end of the Q&A session. Thank you very much, Professor Nemoto, for the insightful presentation. And we already have engaging discussion. From today's session, we have learned how Korea and Japan have developed innovative model of remote healthcare, which is ranging from integrated system and telemedicine platform to AI-based diagnostic and even drone technology. We also explore how this approach can be adapted to developing countries, highlighting the importance of inclusive, culturally sensitive, and sustainable solution. All right, Prof, on behalf of Universitas Terbuka and the Public Sector Financial Accounting at Study Program, we truly appreciate your time, dedication, and valuable insight. But before we close our session, We would like to give you this token of appreciation from Universitas Terbuka and FDAP. Please, ICT. Okay, thank you. This is as a gesture of our sincere gratitude to for your meaningful contribution to today's event. Thank you, Prof. Arigatou gozaimasu. Kamsahamnida. Terima kasih, Prof. Okay, we hope this marks the beginning of continued collaboration and academic exchange in the future. Okay, and we also extend our sincere appreciation to all participants for your attention and engagement throughout today's session. And please note that you will be able to receive a certificate of participation after completing the feedback form, which is the link will be shared at the end of this event. All right, we hope that today's session has offered valuable insight and sparked new ideas for remote healthcare development in your respective contexts. All right, now I would like to return the station to our Master of Ceremony, Ms. Vivi Oktari. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Arigato, Prof. Masatsugu, Nemoto, for delivering such an insightful and achieving presentation. So maybe someday we get a collaboration for the next project. And Ibu Nadhiroh Hardiana, thank you on my deep knowledge and broadening the horizon of the student present today. Okay, without realizing it, we have already sketched the end of today's event. Let us close this season by reciting Hamdallah. Alhamdulillah. Okay, as the host, I would like to apologize for my any mistakes made during this event, and I ask forgiveness from. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.